What does a normal foot X-ray look like? Normal foot X-ray. A normal foot X-ray is a very important part of your health care. It is an image of the body that is black and white. Dense structures appear white and soft tissues are darker. The images are made by an X-ray technician who works in a hospital or in a physician's office. Typically, a foot X-ray will show 3 pictures of the foot, taken from different angles. X-rays of the foot are used to diagnose various problems. It can identify fractured bones and dislocated joints, and it can help determine whether the bones in the foot are aligned properly and healing. It is also used to plan and evaluate surgeries. It can detect tumors, cysts, and other early stages of bone infections. Despite its limitations, a normal foot X-ray is useful for diagnosing several common conditions. The X-ray of the foot can be taken at any time, and there is no need to prepare for it. Children may be asked to remove certain clothing, metal objects, or jewelry. If you are pregnant or breastfeeding, you should tell the technician before the procedure. During the process, you might feel uncomfortable for about 15 minutes. However, the exposure to radiation is minimal and will last only a few seconds. While there is no special preparation required for a foot X-ray, children may be asked to take off shoes, metal jewelry, or any other metal objects. It is also important to inform the X-ray technician about your pregnancy if you are pregnant. While the process may take up to 15 minutes, the actual time that your child is exposed to the radiation is usually less than a second. X-rays of the foot can be taken at any time. The X-ray technician will usually show a normal foot if the X-ray was taken when you were young. You may also want to prepare your child for the upcoming exam. If the examining physician is expecting, they may ask you to remove any metal objects or jewelry. If you are pregnant, you should also let the X-ray technician know that you are pregnant. Although the procedure is brief, your child will be exposed to very little radiation. If you are pregnant, you should tell your X-ray technician beforehand if you are expecting. In general, a foot X-ray does not require any special preparation. You may be asked to remove your footwear, jewelry, or any metal objects, but this is optional. Having a child undergo the procedure can be stressful for both the child and the X-ray technician. The standard foot X-ray is not very detailed. The X-ray technician will only see the foot from the front and the back of the foot, not the sides. The lateral view is also commonly used to see the foot. It can take up to 15 minutes to complete a normal X-ray. While the exposure to radiation is minimal, it may affect the health of an unborn baby. X-rays are essential for various medical purposes, including diagnosing broken bones and dislocated joints. They can also help physicians determine if a particular surgery will be effective. They can also help plan the procedure if you have a foot ailment and are concerned about the results. They can also diagnose certain types of cancers. These tests are often ordered because of trauma and various illnesses affecting the foot. An X-ray of the foot can reveal many different types of problems in a patient. In most cases, it will show the bones and joints of the foot. This information will be used to determine the correct alignment and healing of a bone. The X-ray can also help doctors plan a surgical procedure. If the problem is not obvious, it may be easier to detect. The foot shot can also help in detecting various types of tumors, cysts, or infections in the foot. Normal foot X-ray, normal foot Xray, normal foot Xray.